You laugh, you cough, you jog, and you leak a little. Incontinence is a very common and often embarrassing problem, sometimes so much that patients have a hard time even discussing it with their doctors. Patty Wilson was treated for the problem, and Providence urologist Melanie Crites is here to offer some relief. Thank you both so much for being here and for talking about this, because as we said, it is uncomfortable to talk about. Patty, first of all, tell us your situation. It was 10 years ago when you first started experiencing this.
Yes, I started leaking every time I coughed, sneezed, sometimes walk. I got to the point where I couldn't hold my urine. And it got to the point after 10 years I was experiencing urinary tract infections.
Okay.
6 months I dealt with that.
Okay, and at that point you thought, okay, enough's enough, I'm
Right.
going to do something about it. And what did you have done?
I had the sling put in. It was a routine surgery. Instantly it worked. I mean, I went to my doctor's office, and when she walked through the door, I said, "You're my miracle doctor. You fixed it." But for years I thought this was from a hysterectomy I had and just getting older. And that's, some of it is, but then some of it isn't. It just wasn't right.
And so now you feel, of course.
I feel fantastic. I don't have to cross my legs anymore. I don't have to, worry that I'm going to have to change my clothes, or if I cough, everything's fine.
Good.
So.
Let's talk about this sling that you actually have an example of it here.
I do.
This
is a smaller version of the sling that Patty has. Hers is actually quite a bit larger, but this is a display model. It fits right underneath the urethra. So Patty, if you'll hold out your index finger, the sling actually just fits right under the urethra like this.
Okay.
So that when you cough and sneeze, it gives the urethra a little backboard so that it's not mobile, allowing urine to leak out.
Okay. Now, is this mostly a problem that women tend to have?
It is. Men can have it as well, but typically women are the ones that are the most vocal about it, are the ones that also experience it most often just with the natural aging process, with childbirth, because of the natural stretching properties that childbirth causes the muscles and the ligaments of the pelvis. Menopause also, the lack of estrogen in the vagina causes the tissue to be just a little weaker.
And so if you are experiencing something like this, and it starts to be more of a problem than just here and there, the coughing, it's nice to know that there is a fix for it.
Absolutely. Surgery, exercise, much like women get collagen in their face, we can also plump up the urethra with a collagen-like substance as well. So we have a large variety of treatment options to choose from.
Good to know. And thank you both so much for coming here to talk about this. And Providence Women's Wellness Series invites you to a free talk on treating urinary incontinence. It's March 22nd at Providence Portland Medical Center. For details, go to the Providence Health page on kptv.com.